Thank you. Good morning, everybody, and welcome to our South West London CCG governing body meeting. This is our last governing body meeting of the CCG, and we've got some business to do this morning, but we're also going to do a bit of a look back and a celebration of who we are and how we've got to be where we are and what we've done. So I'll do that later, but we'll crack on with the business first. So just to say that the meeting's being broadcasted live, and it's going to be then uploaded on the CCG website, so that people can see it afterwards. Members of the public will be able to ask questions during this live event, and we'll do our best to answer them in item 9 on the agenda, so we'll keep the questions to that section. I've got apologies this morning from Sarah Blow, our Accountable Officer, Tonya Michaelides, the Locality Exec Director for Kingston and Richmond, and from James Murray, our Chief Finance Officer, but we've got Neil McDowell here for him. There's a register of interests which was circulated with the papers, but can I ask if anybody has any conflicts of interest or declarations of interest relating to anything on the agenda today, or anything that's not on the register? Super, thank you all very much. And we are quorate this morning. And have we got a minute taker? Is Jay on here? Let me just see. I can. Yeah, thank you.
Yvonne's here, Nicola.
Okay, thank you. Okay, so we do the minutes of the last meeting. So this was the 2nd of March. And I think there are no matters arising or open actions, but did anybody have any comments or anything on the agenda that they wanted to raise on the minutes? Sorry. No. Okay, great stuff. So let's go to the first item on the agenda then, which is reports, Chair's report and the Accountable Officer reports. So just on the Chair's report first. So I'm going to take the report as read, but just a little bit of a spotlight I'd like to shine really on social prescribing, which is becoming ever more embedded in our South West London system and really changing the way that people can access support and the way clinicians are managing patients. And the report highlights that we've got a website that gives some examples of the way that some people have been able to make real changes to their life through the support and signposting by a social prescribing link worker. The link to the website's in the papers, so I think that's a really really thing to watch. It's great actually. And then next I just wanted to report on decision made under Chair's action. That's on the clinical and care professional leadership contractual and pay framework. It went to the Remuneration Committee, where it was endorsed and recommended for approval by the governing body, and it's been approved by Chair's action, really in order to enable the implementation of it as part of our transition into the Integrated Care Board, and the governing body is asked to note this decision. And then finally, the National GP Survey results are on their way, and they'll be published in a few weeks, including questions about people's experience of health and care services during the pandemic. So just a few items to flag there from the Chair's report. And then I'm going to go to Karen Broughton, who's deputising for Sarah Blow this morning. Karen, anything on your section of the report?
Thank you, Chair. So a couple of things just to pull out again. I'll take the report as read. When you mentioned that this is the last meeting of the governing body, and that's because new statutory responsibilities for integrated care system take effect from the 1st of July. And Sarah's report points to the fact that the Health and Care Bill has received royal assent, and the fact that the Integrated Care Board will be a new statutory organisation that will have responsibility for leading integration within the NHS, bringing those people together for planning and providing NHS services, and for taking a collective approach to agreeing and delivering ambitions for health and wellbeing of people in South West London. She also signals the appointments to a number of posts within the Integrated Care Board, and highlights the fact that the first meeting of the ICB will take place on the 1st of July between 10 and 1, and reminding people that that is a meeting that is open to all members of the public who will be able to join either in person or to watch MS Teams. A couple of other things probably just to pull out from the report. The support for Ukrainians coming into the UK who have been guaranteed access to NHS healthcare, and within South West London, partners locally working to make sure that those people can access the services they need when they need them. She also identifies the Messenger review, so Gordon Messenger being commissioned by the Secretary of State in October 21 to undertake a review of leadership and management in the health and social care sector, and that report now being published. And it points to 7 key interventions to strengthen leadership and management in health and care, and also points to the fact that obviously this will be an Integrated Care Board responsibility to review and implement, and that will be through the new People Board of the Integrated Care Board. And then I think probably just finally to say, the last time that we met as a governing body, we talked about the planning round and the work that was happening in order to identify our priorities for 22-23, but also the financial plan that then supported that. And I'm pleased to report for Sarah that we have now submitted a balanced financial plan for the system for the year ahead, but that year ahead will be extremely challenging, and therefore as a system we're going to have to continue to work together to mitigate any of the financial risks that emerge as we go through the year. I think that was all to highlight from Sarah's report. Thank you, Chair.
Thank you, Karen. So any questions or comments that the reports might prompt? Susan.
Yes, it was really on the last one. I know that the communications team do a massive amount of work in engaging with our wider community. I just wondered if there'd been any feedback or reflections on the impact of all the work that they did over the bank holiday weekend, and I just think I'd like to commend all the work that they do.
Charlotte, do you want to come in and answer that?
Where's
one?
Charlotte? Is she here? Yeah.
Yes. Thanks, Susan. Yes, we're in the middle of doing an evaluation about that. So we're doing some soft evaluation to ask people, you know, did you see the corgis and all of the kind of bank holiday campaign? But we're also doing some harder evaluation. So looking at kind of operational numbers and how that compares. So evaluation report in progress, but informally we received a lot of positive feedback, particularly actually from our communities, because members of this group, a lot of you recorded WhatsApp audio messages, our lead GPs, because we know these are widely shared within our community groups, and these have gone down really well with community groups because they're very easy to share. And if you have like a doctor or a lead pharmacist talking about services that were available over the weekend, that's really helpful, and in different languages as well. So very difficult to monitor that though, because of course WhatsApp's all encrypted, so you can't track it, but informally went down really well. But yes, we'll be providing a report and I'll send that over.
That's great, thank you. Great to hear that. Any further questions or comments? No. Okay, great, thank you. So the governing body's asked to note those reports. So now on to our next agenda item, so the CCG close down update. So Karen, are you going to kick off with this?
I am, and Ben's here as well if there's any more detailed questions as well. So just to remind everybody that we obviously have the changes to the NHS that were implemented in the way that the paper outlines. So white paper, health and care bill coming in, the Health and Care Act coming in and receiving royal assent. And that meant that in order to deliver the change to integrated care systems, we put 3 things in place. The first was a comprehensive ICS transition programme, and we've talked here and in seminars about that programme and the progress on that. And the report outlines some of those areas that we've been working through. We also set up a governance oversight group, and some of the members of the governing body were members of that group, and that was to make sure that we ensured strong oversight and assurance on the transition from the CCG to the Integrated Care Board. And then finally, a due diligence process and plan assured by internal audit to make sure that those things that needed to be transitioned to the ICB were done well and safely. And the report goes through a whole range of areas. And the idea is that we want to give you an overview of all of those things. But I think what we probably just need to do is to pause on the due diligence process. And the paper outlines a number of things in relation to due diligence. I think the first thing to mention is when we merged the 6 CCGs a few years ago, we used that process as the kind of foundation for due diligence to move to the old system, from the old system to the new system now. So that was really helpful for us. But we also saw that the dates were changed. So originally the work on due diligence had to be completed by the 1st of April, but because of the passage of the Health and Care Bill, that moved, which meant the actions that we needed to take were predominantly happening in June, a month before the ICB became operational on the 1st of July. And therefore, within the report, you will note that there were a number of areas that at the point that the report was written still needed to be completed, because actually we could do those on the run up through June. But Ben may want to say something about where we are with all of those, because I think we're now sorted on all of those, and those actions have now been taken. We also will be in the process as the new non-exec members of the ICB join to hand over from existing committee members to the new, to make sure that there's continuity and that essential information isn't lost. And the report also points to a readiness to operate statement. So that's the work, the assurance that we've had to give to national colleagues on the progress of our work to get the ICB in the best possible place to start on the 1st of July. I think the only other thing to probably mention around due diligence was that Sarah, in her accountable officer role, submitted letters to both the ICB chair designate and the London regional director on the 1st of June to assure that the due diligence process within South West London had been robust, and that we were therefore prepared for close down and the transition of staff and property and everything else that needed to move forward to the ICB on the 1st of July. So there's a lot in this report. I wasn't planning to go through it in huge detail, but obviously we are more than happy to take questions, but are asking the board today to note the progress that we've made, particularly in relation to due diligence and the transition between the ICB and the CCG, and that we are ready to operate because the smooth and safe transition has been planned and is ready on the 1st of July. Thank you.
Excellent. Thank you, Karen. And Ben, did you have anything to add on this at this stage?
That was a very comprehensive overview. Thank you.
Yeah, great. OK, so so comments and questions on this. It's a huge piece of work, isn't it? I wonder if the complexity of going from 6 to 1, going from 1 to 1 has kind of changed things. What was there a big difference in that, Karen, would you say?
I think actually it was helpful. So we had less complexity, and you'll see in the report when different CCGs were given different ratings in terms of were they moving from 1 to 1 or 6 to 1 or 8 to 1 or whatever. So actually the work that we did was a really good piece of work. We'd done it not so long ago, so it meant that doing a different version of it and obviously moving forward gave us a strong foundation. But actually it simplified our arrangements. So it didn't feel that at times because it's a really complex piece of work to move forward. But actually, I think it was helpful to have that, you know, going through that a few years ago.
Yeah, indeed. Ben, was it on that?
Yeah, I was just going to give you an example of that would be, and Neil lived through the pain of this, but merging the 6 ledgers of the 6 old CCGs into one into South West London, and so that makes it a lot easier. We are only transitioning one financial ledger across to a new organisation as an example of, we did a lot of hard work previously but made this one slightly easier in certain aspects.
Yeah, no, thank you. That's a really helpful example, actually, isn't it? David.
Yes, thanks, Nicholas. So let me come in really, because myself and Paul as the two chairs, me chair of finance and Paul chair of audit. So we've sat on the governance oversight group with colleagues. And that's been really helpful. So for me, the issue here is, can the CCG governing body have confidence that all of this work has been done and it's safely passing over to the ICB? So it's that bit, I think, that we concentrate on, not so much around what the ICB is doing, because that's the ICB's business. So for a number of people, it's a bit odd because people are wearing two hats, but me and Paul aren't in that sense. So we've sat through all of this process. When it came to the due diligence, I think what I was particularly looking for was, could we see that, had there been a robust process, was there evidence that backed up a lot of what's in this report? And we saw what had been done, and that actually Ben, when we sat down with Ben and we had head of internal audit with us, we could actually see for ourselves the evidence of, in micro detail, about a whole series of actions and functions that had been worked through and what had happened to those functions. So I was certainly able, and I think Paul can speak for himself, was able to say, we're happy that this has been a robust process, and therefore we were very happy that Sarah, as the AO for the CCG, could confidently say we've been through that and we can safely pass it over to the ICB. That is as much as I think we're able to do as a CCG board, because it's around confidence in that process. So that's where we got to. So I'm certainly very happy, as the chair of the finance committee, say we're passing over to the ICB all of this in a very, very good, strong position, and all the boxes. There were one or two things that I think still can't be done, Ben, until the 1st of July, until the actual transfer, but everything else has been done. So I'm very happy to endorse the work that's been done. This is a very comprehensive report, but there is massive amounts of detail that sits under that, and I think we can have every confidence in the process. Thank you, Nicola.
That's excellent, really. Thank you for that endorsement of it. That's very helpful for our governing body. And actually, Liz, I know you're waiting, but I'm just going to go to Paul now, because I think there might be some kind of related comments here that would be helpful. Paul.
Yeah, thank you, Nicola. I just wanted to concur with what David just said there. Excuse me. You know, we did go through that robust process in the last month or so. Had a couple of additional sessions with Ben and internal audit, and I think the only area, as David alluded to, where there were perhaps, 2 weeks ago there were still some outstanding issues, were around finance, but that was by default because the annual accounts had not been completed and signed at that point. So from my perspective as chair of audit, I'm in total agreement with David. I think you can take complete confidence across to the ICB that a very thorough process was undergone, and we certainly can give that assurance.
Brilliant, thank you. That's excellent. Good. Right, I'll go to Liz now. Liz.
Thanks, Nicola. Yes, it does seem very helpful that we are already and following an existing footprint. So that does seem to make it simpler than for some other parts of the country. Of course, acknowledging that it's still a huge amount of work that's been done. I just wanted to pick up a Health Watch related point, which relates to about pages 25 to 28 on the whole numbering. And the Health Watches have been working together more closely because of the CCG merger, but there's some phrasing, and we're grateful, of course, to have the funding for the additional post, which is working its way through the arrangements for that. It refers to Health Watches coordinating their work to better inform South West London priorities, more closely align work plans across southwest London, we'd appreciated if the minutes could also add in, whilst maintaining independence and a local programme of work, because of course the health watches each have local work that is informed by their own population, whilst quite a lot of what we will be doing will be in common across the piece. It is important that we leave the space for the work that is specific to our own population. So if some wording could be added in on that, we'd be grateful. Thanks.
Yeah, that seems like a very sensible thing to remind us of at this point, and I think it should be reflected in the document. Charlotte, do you want to come in on that?
Yeah, no, I just wanted to say thanks, Liz. That is my omission, so I will definitely add that in going forward, because we do obviously value Health Watch as that independent voice, even though you do collaborate together. So yep, I will make a note of that and we'll fix that going forward.
That's good, thank you. Pippa.
Thanks, Chair. So first of all, I just wanted to thank everybody, because it's a huge amount of work here. And everyone's had to do their day job as well. So thank you, everybody. And really, I think it's hugely comprehensive, and many of us have been involved with organisations that have transitioned from one to another. I think this is probably the most comprehensive handover document, Karen is nodding, that I think I've ever seen and been involved in. So there's a lot of information there for the ICB to use to help inform and risk assess going forward. I was particularly pleased to see the work that's going on about the place accountability
body happy to approve that? I'm looking at a yes. And then just to note the position with the 22-23 agreement. So that's for information at this stage. Excellent, Jonathan. Thank you very much for presenting that very simply and clearly for us. That's great.
Thank you.
Good. Okay, so we've got a series of committee updates and reports. So presenters can take these as read, but I will just go through each one so people get the opportunity to flag up the important issues and for people to ask questions as we go along if they wish to. So we'll start with the finance report. So Neil, you're here on James's behalf. Is there would you like to flag up any specific issues that you'd like to bring to the governing body's attention?
Yeah, thanks, Nicola. Good morning, everyone. So just to note, the report is in 3 parts. So we've got the confirmation of where we ended the year. There's the 21-22 account submission, and then the plan for 22-23. So I'll just go through very briefly each one, just a couple of bullet points on that. So in terms of the month 12 position, we did finish the year with a very small underspend, which was pretty much in line with what we
had planned. Neil, you're frozen. Okay, let's just see what happens. And what we might do is going to see if Neil goes out and comes back again. Let me just give him a minute rather than disrupting the flow.
I've texted Nicola so that he knows that he's frozen because he could be talking.
He might be telling us everything, yeah. I think it probably makes sense to wait for Neil rather than go on to David's, and we've got time. Okay, having trouble clearly. So let's go to David then. David, do you think will it still make sense to go to you at this point? Is that okay, or will it be problematic?
No, I can do, and then Neil can come back in. We had another meeting of the finance committee yesterday, our final meeting as a committee. And we ran through some of this, but I won't steal Neil's thunder on that. Perhaps I just want to draw out a couple of things. So we signed off yesterday the handover report for the ICB, and that's very, very comprehensive. 2 issues as far as the CCG's part of the ICB business is concerned. 1, continuing healthcare, which has been a significant financial risk all the way through for the CCG. Very helpful that Gloria came along yesterday and presented the work that the team is doing there, and we were pleased to see the progress, although as to note that there are still very significant financial risks and a lot of work that still needs to be done to get on top of continuing healthcare. So that is one, that's just relating to the CCG business. That's a specific there. There's some issues about the delegated primary care budget, again, which need to be worked through. So that's one. The other main issue that is around single tender waivers, where these come through the finance committee for approval. A lot of this is about the process, and it's because of the contracting process that the CCG has still got. So there's a lot of external contracts which are now being novated to the ICB. So there is still a lot of process to be sorted out to get on top of these contracts, and also look at where is the potential to, rather than have for services 6 contracts doing broadly the same thing across South West London, can they be brought into one? So there's work still to be done there. The team know that, but I just wanted to for this meeting, the final meeting, just to know those. So those are the 2 specifics that I would pull out, and that's really all I want to say. Neil will go into a bit more around, particularly around the plan for the current year for the ICB, but I'll leave Neil to do that.
Thank you, David. Can I just ask then, just on the single tender waiver and the process? So presumably, I mean, it's been like that for as long as I can remember in CCGs, hasn't it? We've had to know that. Yeah. How soon do you think that could be sorted out? I presume it'll take quite a long time.
Well, it does, and I think all credit to, I think Matt may have left, but Matthew Vidian and his team, because I have to say the process now is far more robust than it ever had been. Some of this is because we had 6 CCGs, and 6 CCGs all did their own thing for a lot of things. And again, one of the comments is you may find, I won't pick a particular service because I'll pick the wrong example, but you'll find there's a service, and actually then each borough has got a minor variation of how they deliver that service. Now the question is, is there some potential to have this done as once rather than 6? I think the reality is, because of these contracts, there are some contracts which have been let for a year and then are you know, that they will have to be renewed. A lot of this also is down to the staff resource to go through that procurement process in order to let a new contract. And so I do think there's probably an issue for the ICB to look at whether, you know, there is enough resource just in that contracting process, because if you haven't got the people to go through and do the work, actually all that the team can do is re-let the contract for another year, and then it pops up a year later, so you never get on top of it. Like, let me be clear, it is far better than it ever has been, but there is more that can be done. So I'm not going to give a timescale. I think probably the reality is it will probably take longer than any of us would like, but there's a challenge there that I think needs to be taken forward by the ICB.
Yeah, that's very helpful. Thank you, Jonathan, on that.
Yeah, just to provide some assurance around that. So I'd agree with David's point that over the last 2 years, through the contracting function, we've bearing in mind we have something like between 300 and 400 contracts as a CCG, we've got to a much more robust process. But I'd also agree with your point, David, about there are areas, mental health would actually be an obvious example for me, where it might be worth looking at having one contractor rather than having a number, potentially up to 6. And that's the piece of sort of assurance I wanted to provide, is through the conversations we've had that Karen alluded to earlier around the place-based accountability agreements. We were wanting to bring place together each month to have a conversation about it, and this is one of the key things I'd like to talk to them collectively in the roundabout about what the opportunity is to streamline some of this process in some areas. In some areas it will reflect different population needs and will be entirely appropriate, but in some areas there is an opportunity to streamline. So there's building on the good work done over the last couple of years, there are some clear next steps in my mind. So I just wanted to give that assurance to the governing body, Nicola.
That's great. Thank you for that, Jonathan. That's great. Neil, are you back?
I am. Apologies for that.
Hopefully no, that's all right. Timing is. So there are 3 sections to your report, and the suspense is killing us. Go on.
So I'm not sure how far we got, but I think I only got halfway through the month 12 position. So just to report that we reported with a very small underspend, and there were no new issues that cropped up at the year end that hadn't been reported to the governing body previously, and all allocations had been received. So the report sets out where the challenges were that we had throughout the year, but hopefully most of the governing body are aware of where those are. So I'll move on then to the year-end update, just to say that the audit committee approved the accounts at its extraordinary meeting on Monday, and this followed the meeting that we had on the 7th of June. And delighted to say that we've submitted the accounts this morning, so that is all on time, so all the deadlines have been met, and to also say all the targets were hit, and we've received an unqualified opinion from the auditors, so I think quite a successful end to the year. Obviously to note that we now very quickly move into the next mini year end, but it's not a mini year end, it's a full year end that we will have to do for the 3 months of the CCG starting on the 1st of July. So no rest for the finance teams, I'm afraid. So I'll just pause there in terms of 21-22 just to see if anybody's got any questions, but I think David probably was giving an update on some of those areas.
Yeah. Anything so far?
No.
No,
Okay.
it's safe to go. Yeah.
Okay, so then in terms of the place plan, so this is obviously it's complicated in the sense that we've done a full year plan, but obviously only 3 months of this plan relates to the year end. But we've now got all the budgets in place. We did have an interim budget up to the point where we got all the place budgets agreed. The basis of the plan was the 21-22 outturn position. And we've also been working through with place-based leaders on how we're going to split all the pay budgets. So for the last 2 years they've been sat in southwest London, and that's now been split out. The other area that warranted further discussion was around the level of efficiency targets that we had in place. A couple of principles with that. One is that we're not going to exceed 5% of a cost improvement programme for each place, but there is some recognition of the distance between the expenditure from 19-20 and the expenditure in the plan for 22-23. So if that gap was a lot smaller, then those places would have a smaller ask in terms of their efficiency. The plan was brought to the Finance Committee yesterday. We did go through in a little more detail around that. In terms of the 3 months, just to note that the actual performance will be adjusted through a resource limit adjustment. So in effect, the CCG's exit position at month 3 will be a break-even position. But that was all I was going to say on that, and I'm happy to pick up any questions as well.
Anything for Neil? Okay. Great, Neil, thank you. Thank you very much for that.
Yep.
Super. And yeah, and thank you for getting the year end in on time, and you know, all the work that you and your teams have done to get us to this point. And I can't believe you have to start again for another 3 months now. That must feel really, really hard. But yeah,
Yes, thank you.
It's an unusual year. Hopefully we won't have another year like that for at least a decade.
Thanks, Nicola.
Okay, so we're going now to audit committee report. So Paul.
I think, Chair, just before I do, I think Vasa, you had your hand up. I don't know if you wanted to comment on that, or that was from a previous discussion.
Yes, thanks, Paul. Thanks, Nicola. I just want to thank the Finance Committee, James and Neil and David, whom I call the senior members of the committee, for running it with some compassion and some kindness, because sometimes when you go to Finance Committee, you think they only talk about pounds and sterling, but actually they were totally interested from a clinician, from what I had to say about the clinical social impact of our decision making, how it transpires into patient care, running a practice. And they were very keen to know what happens to the decisions we make, whether we say yes or no. The patient voice or the patient impact was always heard and listened to, understood and appreciated. And I think we should thank them for that ethos, that culture. James in particular led it, but David chaired our meetings and Neil too. And I think we should place that on record. And I wish that ethos continues as we go into the new organisation.
Thank you, Vasa, for those words. That's absolutely right. I would second that completely. Thank you. Okay, so Paul.
Thank you, Chair. So since our last governing body meeting in early March, we've had the 3 meetings mentioned there, but as Neil mentioned, we also had an extraordinary audit committee on Monday morning, which was to the final approval of accounts, and I'll come to that in a moment. But just in terms of what we've gone through, obviously, you know, some of those key assurance mechanisms, the counter fraud annual report, the update there and the submission for the year end has been done. The business assurance framework, which comes to committee, we've obviously reviewed that, making sure risks are adequately measured and captured. With regards to the external audit report, that is obviously a detailed document submitted at year end, looking at our value for money conclusion. And as Neil said, the key thing for the committee, you know, our targets were met. It's an unqualified report that we can take across. And again, I'd just like to extend my thanks to Neil, to James and the finance team for all the hard work that they've done there in delivering that yet again for the CCG. We also reviewed the internal audit report, and I don't think Nick is on this call, but again, Nick and the team did a great you know, amount of work there, helped give us the audit opinion that we've got in the annual report. And then I think the only other thing I would add is I guess one of the themes that's come across is, you know, one of the risks to pass forward to the ICB is the in-housing of the London support service, and I think it's something we've recognised there are some risks there, but hopefully everyone is aware of what they are and what work needs to be done there to manage that transition. And as Neil said, I was going to ask Neil a question, but he just confirmed that the button was pressed this morning, so the annual accounts have been submitted before the deadline, which is great. And finally, Chair, just to let other members know, at the last full audit committee we had on the 7th of June, we did create a handover document, and basically it's a sort of a due diligence perspective from members of the audit committee, of which there are 9 or 10 items to kind of be aware of that are work in progress, and that is passed to the new organisation and to the new audit committee chair. So that is it from me. Just wanted to again thank everybody on the audit committee for all the work that they've done, and I'd like to think, you know, we can pass something across to the ICB which leaves a good legacy. So that's it from me.
Great. Thank you, Paul, and I think you have, so thank you for your work on that and for steering the audit committee through you know, these several years of really good work. Thank you. Any questions for Paul? Okay, so we're noting that report, and then we'll now go on to the performance report. Jonathan.
Thanks very much, Nicola. So building on the theme of legacy, I think there's many things that the CCG can be rightly proud that it hands over to the ICB. So just to flag a few of those. So around elective recovery and recovering from the pandemic, we have one of the strongest, if not in some areas the strongest position in the country in terms of improving access for long waiting patients. Against cancer performance, we're meeting the new target, the faster diagnosis standard of letting people know whether they do or don't have cancer within 28 days. So that is very good to see. A key priority for us throughout the life of the CCG has been achieving the dementia diagnosis standard, and we've achieved it and gone above and beyond it now. And also in learning disability health checks, which has also been another area that we've been very focused on with primary care colleagues too. We've now got to a place of achieving that target. So I wanted to highlight, there'll be many more, but wanted to highlight those 4 areas of real success and achievement. And then, of course, I'll move on into the areas of challenge, because there remain a huge number of challenges facing us. And probably top of that list remain the urgent and emergency care pressures on the system. Whilst there has been significant progress in the number of patients waiting the longest amounts of time to be handed over by the ambulance crew to the emergency department. They're still way above where we would like them to be, and that flow issue all the way through number of patients, both for physical and mental health reasons, waiting in EDs in emergency departments, and flow out of the hospital as patients are discharged, remains a very fragile position, particularly as we're in the midsummer months. I know there are plans nationally for a long-term strategy on urgent emergency care this autumn, but I think we've all agreed, Matthew Kershaw and I as the joint leads on this have agreed that we need to make further progress, and we've set the 8th of July for a reset session with our chief exec, community, senior clinical leads and others to see what more we can collectively do to prepare for the challenging months ahead. Also in that same space around urgent emergency care, as the board is aware from its March meeting, we've re-procured our integrated urgent care services. Those services went live at midday on the 31st of May, and I'm pleased to report that handover went very well to the new provider, to PPG, with more than 100 members of staff involved at that point of handover, and 11,000 calls managed in the first week, to give some idea of the scale. The key performance indicators changed somewhat between the old contract and the new, so it's hard to have direct comparison in some areas, but I think a critical area is the abandonment rate, because that says something quite important about patient safety issues if calls are a significant number of calls are abandoned, and also says something about the pressures on the rest of the urgent emergency care system, and that at the moment is about half what it was at the end of the Vocare contract. So that's significant progress. There's about 80% of calls are undergoing some nurse-led clinical triage, and about 30% are going through the clinical assessment service. So in terms of the clinical safety aspects of the service, I think it's in a good place. The out-of-hours service is up and running well from all the feedback I've received, and the booking into primary care is also working well. The speed to answer calls needs some more work, I think would be fair to say, and there are ongoing challenges around workforce, as all parts of the NHS continue to face, how the single virtual call centre works across the capital, and some very specific issues on the St George's site about how this service works that we're continuing to work through as part of the service development and improvement plan. So I've spent a little bit of time on that, Nicola, because obviously that was a big decision, so I wanted the board to be cited on the decisions made, and particularly also wanted to thank Pippa and David for all their support to me as the executive lead on this through the RUC oversight group over the last year or so, as we've navigated our way through this procurement process. So that's the first area, urgent emergency care. In terms of other areas, I'd flag that I think on planned care we're seeing a small growth in the very long waiters, so there's more work to do there, and in the overall size of the waiting list, so those remain areas of challenge. In diagnostics, there's a great amount of work going on, including the proposals we put in to develop more community diagnostic centres, but there's more we need to do around the variation that we see across our providers. As I've noted previously at the board, there's still more work to do on the breast recovery pathway for cancer patients, and the challenges that I've described in urgent emergency care also apply to mental health, so real challenges on mental health, bed availability, and for both adults and young people, and also challenges around improving access to psychological therapy services and achieving what we need to there. So some real successes, Nicola, but also some real pressures and challenges as we move forward into the ICB. So hopefully that's a fair summary of where we're at. And again, obviously very happy to take any comments or questions people may have.
That's great. Thank you, Jonathan, for that. That's very clear and comprehensive. And I have to say thank you to you and all the people involved, because I know there are a lot who put together the reports. The whole system is performing, but actually just pulling the reports together and making them into a format that this governing body has been able to digest and use and work through is really important. Shouldn't underestimate how difficult it is to do that. I think you've done a really good job to get us to the point we're at now that we can take forward into our next version. So thank you for that. Any particular issues from anyone? Questions or comments on the content of the performance report or anything related? No. Okay, thank you. Thanks very much, Jonathan, and we'll move on to Pippa now. So
sorry, Nicola.
Yeah.
My
sorry,
apologies.
I'm having trouble seeing people. Matthew, sorry.
No, I was slow on the buttons. Apologies. I mean, I just quickly and not changing what Jonathan said at all, but just adding to it on the urgent emergency care piece. That is a real continued pressure for all parts of the system. Only yesterday the Georgia system was in a particularly challenged place. South West London actually did what South West London I think does very well, which is come together and try to manage and share that challenge amongst other providers across South West London. But I think it's important that this body and then the ICB going forward is aware of the current challenges, and I'd endorse absolutely Jonathan's point about the importance of the work that we're doing going forward, because we're in June, not the winter. In fact, we're as far away from winter as we could possibly be, being the first full day of summer, but it's still very pressurised, and worth colleagues being aware that is happening, and that there is a lot of work being done to try to address that, and that reset is going to be really important.
Yeah, absolutely. Thank you, Matthew. I agree with that. Agnello.
Yeah, just to add in terms of the challenges going forward, and not mentioned yet, it's about the staffing issue, whether it's in primary care, whether it's in secondary care, all along the pathway, and remains a challenge. And I think in terms of the ICB going forward, how do we start to address that? And it's going to mean doing things differently, a step change in the way we do things, and transformation, but also to hold a ring around what we're actually doing now as well. So whenever there's a challenge, we rise to it, and I think this is the time that we will rise to it and make a difference and do it sustainably, because we know what needs to be done and how it can be done. We need to make sure that when we do it, that it sticks.
Yeah, absolutely, Agnello. And when I was looking at the planning documents that have come with the papers as well, to see that we've got workforce and urgent care system right up there as huge priorities, that's absolutely right. That's where we are. That's absolutely critical, isn't it? Good. Okay. Any further comments from anyone? No. Okay. Thank you. So we'll move on to Quality Performance Oversight Committee, QPOC. Pippa.
Thank you, Chair. So there's two reports here you've got. So I'm just going to highlight a couple of areas for you. Before I start, just to say I'm not going to concentrate too much on performance because I think Jonathan's given you the update, the most recent update on that. Just a reflection on QPOC. One of the good things I think about QPOC has been the breadth of the conversations we've had in the areas that the CCG is responsible for. So both physical and mental health, I think you can consistently say, have been agenda items that have been considered throughout the 2 years, and both in hospital and out of hospital. So I think we haven't just looked at one area, so I think that's really important. So on our meeting on the 13th of April, a couple of things to highlight. So something that the ICB will need to keep sight on is the progress on the initial health assessments and the review health assessments for looked after children. There's a lot of work going on both across South West London and at borough and place level. Gloria and her team, I know, have got this in their sights, are doing a lot of work, but there is still more work to do. So that is forming part of our handover process. On page 3 of my report, the South West London strategy, there's actually an inaccuracy. We received the first draft, not the final draft. It wouldn't have been appropriate for us to have the final draft, the quality strategy. That needs to be signed off by the ICB. And I know there's been further discussions at the Recovery Board about that. So that's well and truly in place and will be a key strategy for taking forward quality in the future. The other area on this page was the SMI health check. So as Jonathan says, a lot of work's been done on the LD health checks, and we are now reaching that target. There's ongoing work and learning going on in South West London from systems who have made good progress on this. But again, that's something for the Quality and Oversight Committee to keep their oversight on. And then moving on to our meeting in June, you'll see that we had a deep dive into stillbirths at St George's and the outcome of that and the good assurance that we received. Continuing healthcare, David has also talked to you about, so that's both a quality and a finance piece of work that is ongoing. On page 2, I just wanted to draw out some really good work that was done with the Safe and Wellbeing reviews and the outcome project there. So these are working with some of our more vulnerable clients, and there was an excellent piece of work that was carried out using people with lived experience who are supporting the work, and we supported the recommendation that an annual stock take to ensure that the voice of the patients and families is carried out each year, because I think it's a really, really good piece of work that was undertaken. We had a good feedback on primary care quality, again another key CCG responsibility that will transfer. Discussion is going on about where and how primary care quality is going to report to the ICB, so that just needs to be followed out. And then we had a good update on Ockenden, again something that I know the ICB are going to keep their eyes on. There's a very robust process in place, and you can see the update there on page 2 of my report, and 2 of the assurance visits have already taken place. And finally, I just wanted to thank everybody at the governing body. I did thank everybody in the committee for their hard work, both the executives, Gloria and Jonathan and Tonya, who've been fantastic, and all the other members of the QPOC. So thank you very much. I'm happy to take any questions.
Great, thank you, Pippa. Karen.
Pippa, I just wondered if you could say more around the stillbirth issue, why it came up, and the summary of why you're now assured that it's not an issue.
So yes, I'm happy to start, and then I'll hand over to Gloria, who's the executive lead on this. So there was some data that indicated that there may have been an issue with the number of stillbirths that were occurring at George's, and what we were trying to, this has been an issue throughout the 2 years. So at the beginning we had somebody from George's came and talked to the committee because of its tertiary nature and the fact that a number of referrals go to that site where they are more complex births. That there is obviously an increase in numbers. Gloria, did you want to add anything here?
Yes, Pippa, thank you. Really good introduction to it. Yes, what we wanted to assure ourselves is to make benchmark ourselves against other tertiary institutions, just to make sure that we are not an outlier. So the team did, those are the outputs we asked them to do. So they did carry sort of like a benchmark exercise. So they did benchmark themselves against places like Bath Elves, Kings, and so on and so forth. That's our other level 3 tertiary center, and we actually come out comparable. And I think of really concern was what happened last year, November, and I think that's the one we really pushed the team on, that we want to really see what they've done and the progress they've made, because November 2021, there was actually significant increase in still bath, and I'm aware because it did carry me along. But I think we've got the assurance that they put robust plan in place, and they're still monitoring oversight at LMNS level.
Great, thank you. Thanks for that question, Karen. Yeah. So yeah, and I've been struck by how the Quality Committee had, potentially such a huge agenda to deal with in these couple of years, and have just, solidly worked through it all. I think it's been, really impressive, Pippa. So, thank you for your work that you've done on that. Appreciate it. Karen, did you want to come back in? No. And Gloria? Still,
yeah, I just want to support and echo your thanks to Pippa. I think it's been incredible in terms of support to us, especially from quality and performance point of view, and not even just that, even in establishing the ICB quality, and our support in terms of on the Quality Council, I think cannot be underestimated. And I just want to thank you for your work and support, Pippa. Thank you.
Thank you very much. Okay, so we've noted that report, and we'll move on now to Susan for the Primary Care Commissioning Committee.
And thank you, Nicola. This is a verbal report because we only had our meeting last week. Again, I'd just like to add my thanks to everybody who contributes to all the committees, and particularly the primary care team, Andy and his team, and Mark. Obviously, David sit on there, and you've mentioned some of the issues that we cover at the primary care. But this last meeting, we focused really on the end of year finances and the budget for 22-23. Has already been highlighted. There are some issues around the delegated budget, but the team are working hard to understand the history and develop plans to address the underlying deficit. We looked at the handover paper for the ICB. A few more suggestions were given, which identified the ongoing financial risks of primary care, the rising pressure for additional investment in the estate in primary care. And we also noted that though the operating model for primary care moving forward is a contracting framework at South West London level, the focus on transitional elements of the and focus on the delegated budget, the transitional elements of primary care are going to be just as important, though that might not be covered by the primary care contracting group. It's going to be important that we ensure effective public and patient engagement and some transparency in that decision making. So we've been looking a bit at that, but I think moving forward that just needs to be reflected, understood about how that will be reflected in the ICB. And thirdly, we received our usual reports from the boroughs and a number of contracting issues. We've had lifting of 2 remuneration notices, which is always a joy, and reflects all the hard work that the primary care teams have given in support of the practices and the practices work themselves. We've had some assurance around some caretaking arrangements that are now in place for patients attending the village surgery in New Malden, following the decision by the CQC to cancel the practice registration. And again, we also have some oversight of some of that quality issues that Pippa talked about that come to the Quality Committee. So thank the team, and that's the end of my report from the Primary Care Commissioning Committee.
Excellent, thank you, Pippa. Questions on that? Susan, sorry. Any questions or comments on that? Okay. Oh, there is. Sorry, the hands up are a bit slow today. Mark, thank you.
It's not a comment. It's just thanks to Susan for steering the Primary Care Commissioning Committee brilliantly over the last number of years, and just making it a really kind of thought-provoking and constructive committee where we could take knotty issues and kind of work them through. So just thanks to Susan.
Yeah, indeed. I seconded. Thank you very much. Okay, I think we're on the home run. David, Remuneration Committee.
Yeah, so the only issue we had was the clinical pay framework for the clinical leads. So, and that was the point you raised in your report earlier, Nicola. So that was the only issue we dealt with. Thank you.
Good, thank you. Okay, so all of those reports noted by the board, and so that's the end of that section of the agenda. I think we deserve a stand up and a move around, actually. So what I'm going to propose is that we if people could go off camera or go and grab a cup of tea or do whatever you need to do, and we'll be back at 10:35. Okay, just get 10 minutes. Super. See you all in a minute. I think most of us might be back now. Jolly good. Thank you, folks, for being prompt. So maybe a little change in mood and tempo now. So the business is done. And as we all know, this is our last governing body meeting of the CCG. So we're going to spend some time reflecting on the work that we've done in the past couple of years and what we've achieved and what we're passing on to the new Integrated Care Board. But first, I wanted to thank some people. So we've got some governing body members who are stepping down at the end of this month. So I'm going to just go through and talk about each of them and thank them individually. Feel free to use the reaction buttons to convey your appreciation of the work that they've done. But we're not going to do kind of individual rounds of applause, although in our minds they each deserve one. But let's thank them. So first of all, Agnello, Dr. Agnello Fernandez. So Agnello was Borough Lead for Croydon and CCG Chair for Croydon in the past, and he's a GP in Croydon, and his interests include Croydon, making urgent care better, winning awards, being a brilliant GP and clinician. Thank you, Agnello, for the work that you've done for the board. And David Smith. Let me just see if David's up on screen. Yes, he is there. I can see him now. So he can count better than anyone I know, maybe apart from James Murray, but he has this ability to do the strategic translation of that. And David, you brought really great experience of social care and local authority system with senior NHS experience, and you've been absolutely the sturdiest of lay members. So thank you very much for all that you've done. And Paul Gallagher. So Paul, do you want to come up there? Paul's been our audit chair, brought to that a really broad understanding and experience across the public sector, local government and industry, and you've had this quest for ensuring accountability in our CCG. So I really want to thank you for that, because audit committee is not everybody's cup of tea and you've done it brilliantly. Thank you. Patrick, Dr. Patrick Gibson, Borough Lead for Richmond and CCG Chair for Richmond in the past. You know, Patrick, you've been this like constant human influence in our team, really. Someone who reminds us what the human impact is of the decisions that we're making. And you and I share this passion for all things cardiovascular. So I've always, you know, felt very connected to you. And you've supported me and others many a time with a chat and a listen, and that's been really appreciated. So thank you, Patrick. And then we've got Pippa Barber, our lay member with a portfolio including quality and safety. Pippa, you've been just a real custodian of those important elements of healthcare, and you've really strongly steered that committee and its members in a way that, you know, it reminds me all the time that you are at your heart a nurse, someone who's been in a caring profession and certainly never really left it. So Pippa, thank you. And Susan Gibbon, our lay member for patient and public involvement, and you've helped us to keep patient care right at the centre of our thoughts and actions, and you've chaired the primary care committee extremely well with a, you know, firm and competent hand, and it's really complicated, and you've got people like me to contend with, and I've always been struck by the respect that you've shown people and the time that you give people, so, and that's been much appreciated. Thank you, Susan. And finally, Vasa, Dr. Vasa. Would you ever forgive me for not ever attempting your surname? Vasa, you've been the Merton CCG Chair and Borough Lead, and you've had probably half the airtime of some other members of the governing body, but still managed to say twice the number of words of any committee member. And you know, I know you won't mind me taking the mickey out of you because of that, because you're one of the most good-natured men ever, I think. But more than that, you've got this this extraordinary leadership power, and you don't even know it. You lead by example, and you've got such great integrity, and you always focus on making a difference to people who need it the most. So Vasa, thank you. So thank you all actually for your extraordinary commitment and wisdom and the work you've done on behalf of this governing body. We said goodbye to Andrew Murray, our CCG Chair, and to Naz Giovanni, who's Kingston's GP Borough Lead at our meeting in March. And we're going to be hearing from those governing body members that I've just thanked a little bit later about what they've learned during their time in the governing body and what they would want to pass on to the new Integrated Care Board. But first, I'd just like to thank some of the executive team who will be moving on from South West London or changing roles, and some of them are going to form the new leadership team for the Integrated Care Board. And yeah, it's been a significant task, as you've just heard with the kind of things that we've been discussing. It's been such a huge task to do this transition, but really to steer the organisation through its early days and then unexpectedly through a pandemic. You've all kept just a steady hand and a cool head and supported the governing body and led your teams, and yet you've also maintained this focus on delivering service and then all this planning for the new ICS. I mean, what an excellent bunch you've been. I just think you've been fantastic, and we're moving into this new world much stronger as a result of the work that you've done, which has helped us as a CCG to engage with all parts of the health and care system and our local communities. And so thank you to Sarah and the exec team for your commitment and leadership. And I'd also like to thank the people behind the scenes. So many of you have kept the wheels on and the gears oiled in just a quiet, efficient way. Some of them here today, Jay, Kate, Yvonne, can't see all of them, but others who've contributed to and in the past. So important to have you there, and we do really appreciate it. And we're of course hugely grateful to Liz Mirabeau, who it took me a long time to realise you weren't called Raymond, Liz, I have to say. Thank you, Liz, and to Bruno Meekins, who they've been attending our meetings on behalf of Health Watch and the voluntary sector. Thanks to both of you for your commitment and your insightful contributions and your constructive challenge. And we welcome continued involvement and close working with Health Watch and the voluntary sector in our new integrated care system. And having the perspective of local authorities represented at these meetings has been invaluable. We appreciate the regular attendance and injection of public health insight of Dagmar Zoyner and of Ian Dodds and Nick Ireland, who've provided expertise in children's and adult services. And we're looking forward to working more closely with our local authority partners in the ICS. And then last but by no means least, I'd like to thank Asia Yunus, who isn't here today, and Julius Parker, attending on behalf of the local medical committees and bringing in the voice of GPs from across South West London. And we're looking forward to ongoing constructive dialogue and will continue to value your contributions. So thank you very much to everyone involved. So South West London CCG came into being on the 1st of April 2020. Following the successful merger of our 6 constituent CCGs. And of course, at that time, that governing body couldn't have predicted the impact of the COVID pandemic. My goodness, we had no idea what we were in for, did we? And we've had to work and lead really differently from how we thought we would. But people adapted and contributed in really remarkable ways and made the whole system work in this time of crisis. And we never really expected to become so proficient at meeting online. Can you even remember now? But it was always quite a big deal to have a face-to-face meeting where someone is actually elsewhere and dialing in. What a marvel that was. You know, it's hard to imagine now the kind of digital naivety that we had. But you know, I think our teams became sort of stronger in a new dimension, really. And people through the pandemic had huge purpose, a common enemy. And the pandemic really galvanised our teams. I think we developed a real sense of how we could do things together more effectively, and a real sense too of who the people are that need us the most. You know, COVID shone a light on inequalities in a way that hasn't happened before. And I think we'll do better as a result of what we learned from that. So this governing body has proved to be a really dedicated and committed team, focusing on improving health and lives of people that we serve in South West London. And each of our governing body's members has made a really unique contribution to the CCG. And I did a quick count of our years of experience. Not easy, because some of us look younger than we are, and some of you look older, not naming names, of course. But as a very rough estimation, over 300 years of experience between the members here today, and that's not counting times in nappies and nurseries and things like that. But I'm not so good at maths, so maybe could David Smith just double check that addition for me, please? So we wanted to try and capture some of the insights of all you wise people and some real learning from our very experienced governing body members. So I'm going to ask each of you just to give us a nugget of what you know that we can take forward into our integrated care board. I'm going to start with Susan. Susan, could you give us a nugget?
Well, just first, I'd like to acknowledge how privileged I feel to be part of the team that puts local people and the public as its priority, and its staff as well, particularly over the pandemic. And the amount of hard work that I've seen, not only to keeping the show on the road, but service improvement over the last 2 years by building strong alliances with partner organisations has been inspiring. And my reflections are that in supporting these alliances, we recognise that not all partner organisations have the same amount of influence, capacity or resilience. And we need everyone to collaborate, don't we, if we want to have an impact on health inequalities. And therefore, it's how we make sure that some of those small organisations and teams, and though there are many GPs, they each come from individual practices, there's also the additional voluntary social enterprise sector, Healthwatch, and all the myriad of community groups that we're now connecting with, making sure that they continue to have sufficient resources to be able to be actively contributing and being heard as we deliver health and care across South West London. And as a public accountability body, it's clear our decision making has to be transparent, but we also need to make sure that the voice of local people, because what I've seen is when we do that, we make much stronger decisions across our community. And it's really strong bedrock on which I look to the ICB and the ICS to build on, so that our alliances with local people grow from strength to strength, really. And I wish everybody all the best with that opportunity. Thank you.
That's great. Thank you very much, Susan. Let's go to Patrick.
Thanks, Nicola, and I'm not sure about your maths about 300 hours experience, but I can certainly understand the logic of trying to bring the numbers down in to have us a safe base. So I'm going to preface this by apologising. This is going to be a process-focused offering rather than a directly patient experiential one, which I sort of vaguely feel it sort of ought to be in a way. But the premise of bringing clinicians into the CCG concept was that they're closest to the population would add value, and we as clinicians should perhaps be measuring ourselves against that. So in that context, my principal learning has been that we extract far greater value from our clinical leadership by creating structure around it. Historically, I would reflect that there's been a lot of not quite Brownian motion, but we've certainly achieved far less by flying solo. So health and social care is an exceptionally complex environment with eternally overlapping areas of work, and the model of individual topic leads working in relative isolation, I think, was not really fit for purpose and had limited impact. So my feeling is that the development of our clinical leadership group, our Senate, our clinical networks has created more holistic networks across sectors and across boroughs, enabling sharing of ideas and experiences, which actually bring efficiencies, greater consistency, and the real prospect of using a population health management approach to properly address the inequalities that we were talking about before. I think we're in a much better place to do that now as a consequence of that than we were before. I think also the isolation of frustration that Leeds previously had experienced is being replaced by a recognition that others are available and that they're part of a wider problem-solving team. So at a local level in Richmond and Kingston, we've tried to replicate that structure through our local leads group, bringing together topic leads and the PCN, the Primary Care Network clinical directors, and the Federation alongside a clinical leaders group around the footprint of Kingston Hospital. And my pass on to the ICB would be an extension of that, really. So I'd like to see the perpetuation and consolidation of some of the cell structures that served us so well, the clinical cell structures that served us so well in COVID. So bringing together clinicians and managers in a really well-led, relatively informal, cross-borough operational setting with flexible membership, I think allowed effective, quick action plans to be generated where necessary, where there are acute issues, as well as being a forum where hurdles that emerge obstructing longer term work stream development, such as long-term condition work, where they could be aired and overcome through a network approach. And the next challenge for us within that sort of group setting, and bearing in mind Vasa's earlier comments about how blessed we are with our finance management team. So one of the challenges for us is to bring our finance teams closer to the work of those groups at an earlier stage, and so the outputs can be operationalised most efficiently. So just in conclusion, it's been an absolute joy doing this work. I wish I'd started it earlier. When Andrew tried to talk me into it, he talked about the quality of the people.
Thank you very much, Patrick. Thanks very much for that. Let's go to Paul now.
Yeah, hi, thanks, Chair. I mean, I'll be very brief. As some of you may be aware, I've actually been a NED doing finance and audit for 15 years. Been through the PCT as it was, then the individual CCGs. And then the last 2 years, obviously, the consolidated Southwest London CCG. And I think for me, the last 2 years have been, in a way, when I say the most exciting, the most challenging as well, because we were, I guess, forced almost immediately from day one to innovate in, you know, I'm looking at it from a ways of working perspective, the usual, and I think you said, Nicola, we'd always been used to working in committees and sitting in rooms, and to try and suddenly work in a very different way was a challenge. But I think in a way it also demonstrated that when we need to innovate, then we can do things differently, and you know, within a few days, within weeks, it was the new normal. So I guess my kind of remark would be is to continue to look for innovation in how we work, in the things that we do. There are lots of structures and cultures, and you know, I work with lots of different organisations. Every organisation has its unique culture, but I think in the NHS it's something, you know, inherently conservative in the way meetings are set up, the structures, the cycle. You know, we have to push against that. So using technology going forward, I think we can be a lot more nimble and a lot more adaptive. I would also say as well, my own experience, you know, when we sit in audit committees and finance committees, yes, it can be quite demanding, quite detailed, but I think I would also add that I've always really appreciated the GP and the clinical input to that as well, the perspectives there, and I think that's something absolutely we cannot lose going forward. And I think finally, I mean, we've worked on a commissioner split and provider split for the last few years, and the parties have been sort of well established, well known, but I think, you know, going forward now, there's a multitude of agencies, of providers, of other organisations in the mix, and it will get more complex. And I think somebody mentioned before about knowing the sort of scale, the size of different partners in the organisation, and not perhaps overlooking some of those smaller alliances and partners. Absolutely critical that they're all included, and you know, we listen and get a perspective from those. So I think those would be my reflections, Chair, and you know, thoroughly enjoyed my time working with everybody, and wish everybody well.
Thank you very much. That's great to hear, Paul. Agnello.
Thank you, Nicola. When you counted the years, I was just reflecting, it's my 33rd year in general practice and in some form of leadership position, so it's a long time.
You are always a significant contributor, Agnello.
I started off with black hair, and that's my natural look, but it's not quite black now. But you know, the question was, what is it that, you know, we've experienced as a CCG that we would like the ICB to consider and take forward? Very difficult to summarise the period that the CCG has been around, both in terms of South West London, but also in terms of the boroughs. But I can summarise it in one word, and that's relationships. Relationships have been the key hallmark of what we've achieved and why we've achieved what we have. And the one thing for me during this era has been that connectivity between the governing body or the board and the front line, so that there is that finger on the pulse of what actually is going on. You know, what is the impact of what we're doing, and more importantly, what's the impact of us not doing something? So that's been a real important aspect, I think, of that relationship with the public and patients that we mustn't lose. And you know, the ICB needs to have that finger on the pulse. The second bit of the relationships was as Croydon CCG started off with a financial deficit. So being in financial balance, and what we discussed earlier on, is absolutely important. Unlike the CCG handing over to the ICB, where we are in financial balance, we weren't so lucky in Croydon when we took over, and we were in severe financial difficulties. We inherited debt, but because of the backs to the wall situation, it changed the way we worked. You know, quality was not something that was going to be sacrificed, and quality drove the finances, not the other way around. Starting off from a position of deficit, we ended up with a financial balance in Croydon, and that was because of relationships between GP clinical leaders and other clinicians, and with managers, and clinicians and managers working together is so important in terms of achieving the changes, both in terms of some of the performance issues, the transformation that we've had in planned care, but also in all the changes that have gone forward. And the third element to the relationships is about how stakeholders have worked. And in terms of South West London, it came to a fore during the pandemic, and you know, working virtually with so many different stakeholders that you've never met before was something that we had a common purpose. And in Croydon, stakeholders working together came together as the One Croydon Alliance, which is a precursor to integrated working. Local authority, the NHS in Croydon coming together with the voluntary sector in terms of Age UK and wider voluntary sector, the GP Collaborative and the Mental Health Trust. And that gave us a really strong basis to go moving forward. And so that element of relationships to take forward at place, but also at ICB level is really important. One of my biggest lessons was during the pandemic was, you know, we sit on boards and governing bodies, and we think we've got the finger on the pulse, and we think we reach the people that we're supposed to reach, but the pandemic showed that we weren't reaching the people that we needed to reach. And the community groups actually came to the fore. So in the importance of working with community groups, the importance of working with faith groups, and being able to move upstream in terms of prevention, as well as looking after people when things go wrong. And the other is the health inequalities, and we're going to tackle health inequalities, and the ICB is tasked with doing that. Those relationships are really important. And the MHIP type principles of the project, of the Ethnicity Mental Health Improvement Project, the principles of that in terms of excluded groups is something that could be adopted right across the board. So there's a number of things, but there's one word, and that's relationships. That has been my lesson during all this time, and how those relationships are built, are maintained, are cultivated and developed. And that includes with patients. And I think if we've got confidence as citizens in our services, because we know what they're providing for us, and we have influence in terms of how they work, then I think that gives us a lot of succor. So finally, from my point of view, it's been a real honour and a privilege to have served both on this governing body, and also as Borough Chair for Croydon. And as a citizen in South West London, I look forward to watching the ICB build on the legacy of the CCG going forward. And I'm sure with handing over to the ICB in a really positive, in a positive way, and in a positive state. So thank you to everybody that I've worked with and for all the support that you've given me, and look forward to watching on the other side of a Zoom meeting, seeing how things are going.
Thank you, Agnello. Thank you. Excellent. Okay, Pippa.
Thanks, Nicola. So I agree with everybody, what everyone has said, and I think just to say at the beginning how although this wasn't necessarily what we all thought we were coming into at the beginning because of the pandemic, I think what made it much easier was very much a shared set of values, and I never felt that I was butting up against that in a difficult way. And I'm old enough to know how important that is to me. So that was really good. And I think, you know, I have to thank working with some very talented and incredibly hardworking people in South West London who absolutely had patients and staff at their centre. So my way of working and principle, I think that I just sort of pass on really, is for the system going forward to continue to think about not just the what of what we're doing, but how things are done. So it really builds on what Agnello was saying, really, and developing a sustainable and improving culture. It's a key message in Messenger, which Karen talked about earlier, listening and valuing diverse voices and cultures. And a culture of co-production, we've seen that leads to better and more sustainable outcomes for staff and our population. And asking the question, what are we missing? And really meaning that and valuing it. Now, I've heard it from some of you, so I know some of you absolutely live and breathe that. And I would ask going forward, so we are doing really well in some areas, so be ambitious for the population of South West London. If we're benchmarking well in London, why stop at a London benchmark? And then continuing to develop the culture of learning and improving. What we saw in the pandemic was that not one person had all the answers. We rapidly did PDSA cycles on the move, listening, learning, developing, improving our outcomes and our offers. And I think we're going to hear many more examples of that in a minute. So culture is often tested when things don't go as planned. Well, we had a massive test of that, and I think came out in a good place. So how the system reacts, supports, learns and improves going forward, I think is worth paying attention to. And building on Agnello, it takes trust and relationships and a will to do it. Doesn't come about by chance, but I think the ICB is in a really good place to grow on what's in place. So think about how things are done going forward as well as the what. And thank you, everybody.
Thank you, Pippa. Nice words. Thank you. David.
Yes, thank you, Nicola. I think if we're counting up the years, so I actually joined the NHS in 1975. So and then I came back into South West London when I retired from my full-time job. So actually, as well as being the last meeting for me of the CCG, this will be my very final NHS meeting. So so just really reflecting on the 4 years I've had, two when I chaired the committee in Merton, also with the CCG, with the South West London. What's been so important to me was two things. Firstly, the really positive relationship we've had with the finance team, and particularly James isn't here, but particularly working with James, it's been so positive. And also with Neil McDowell, who was the finance director also in Merton and Wandsworth as well. So particular thanks also to Neil. And as I said to Neil yesterday, we couldn't have done the work through the finance committee without the openness that we've had from Neil and from James, being open to engage with us, being straightforward about what the issues are and to be open to the challenge. So that has been so forward, and it's the only way these committees can work, by having that that positive working between the lay members, non-execs, and the executives. So that's the first thing. And the second one, I'm so passionate. If we look at clinical commissioning, again, the input of the GPs into our committees has been so important. And the finance committee in particular, where Naz isn't here and Naz Giovanni stepped down, but Naz Giovanni, who I've known for many years, but Naz Giovanni being on that committee, but also Vasa as well. And, you know, to have that level of engagement and that clinical voice has been so important to the work we're doing. So that's really two things for me. I think so going forward, I think the new ICB holding on to clinical commissioning really, and the really good stuff that clinical commissioners have delivered, and that's so important. And the other one for me is a slightly broader one, and that's about the input the non-execs can have. I've had the pleasure and privilege to chair the wider group with the finance non-execs from each of the trusts, and that has just been so positive to actually, again, working with James and the team and having the finance input from the trust. But those people, the level of experience and skills, and this is also from people who are not just born and bred in the NHS, they've got wider perspectives. There is such a calibre of non-execs within the system, and I would really hope that the ICB can really harness that positive input that the non-execs can have across the system. So thank you to everyone. It's been great working with everyone, and I wish everyone best for the future. Thank you.
Oh, great. Thank you, David, and thank you for so many years of public service. Extraordinary. Thank you. And finally, I think, yes, Vasa.
Thank you, Nicola. And thanks to everybody for all the good work you have done here at the CCG, to all those who have worked in the hospitals, in practices, in the community, in the borough, the volunteers, everybody who has done so much for us that we really don't have the time to thank them individually. And sorry if they have left you out today. It was never by intent. It's just that we had such a short time to say thank you. And Nicola, I think if I can say the thing we prioritized, clinical commissioning with the public, with the patients, with the staff, with institutions, communication within institutions, between institutions, things we never done before. We did it very well. We truly listened. We heard, we looked, we saw, we felt, we sensed, and we changed. We did not stick to what we did yesterday. We changed today, and we even change it tomorrow if we had to change it. If you look at the story of the vaccination program, it was constantly changing based on what we heard through our comms team. To me, the process of democratizing health has begun, and this journey will not continue. We have to remember that during these difficult times we have come through, that the public reached in to help us more than we reached out to help them. The sacrifices they made during lockdown, during masking, coming up vaccination in the cold of December 2020, people who were 80, people who were 75, people who were 85, they turned up in the middle of winter, December 2020, stood in queues to get vaccinated for their benefit and also to save the system of the workload. So we really have to accept that they reached in far more than we reached out. We also have to say thanks to our staff. The goodwill they gave us was more than humanly possible. The kindness and compassion they displayed, despite personal challenges at home, should never be forgotten. Whispering words of comfort, holding the hand, bringing hope where there was fear, bringing comfort where there was pain. This is what our staff did for us at our time of need. And now in our good times, we have to remember them. We should build on this platform courageously. We should now start discussing difficult conversations regarding stewardship, responsible use of resources, self-care, prevention. We must remember it is the public's healthcare system. It is their health we are here to serve, and therefore we should not fear when we speak the truth about whatever the issue is. We should proceed on this journey of what I call the democratization of health. Similarly, as we go forward, we must not take our staff for granted. We must take them with us. We must show them that we care. We must not tell them that we care. They need to see it in what we say and what we do. Nicola, I think in the future, as long as we continue to prioritize patients above institutions and ensure transparent decision-making, clinicians will retain their credibility, and thus clinicians can communicate with the public both palatable and at times challenging truths. And if we do that, we will definitely succeed in our mission to improve the health and the well-being of the people we serve. So I call upon the future leadership to be the light, be the vision, and show the passion.
Bata, thank you very much. Thank you. Thank you all. Words of wisdom. Thank you. Much appreciated that you've taken the time to do that. And Millie would like to say something.
Thank you very much, Nicola, and thank you, colleagues. First of all, I would like to say a heartfelt thanks to all of you who've got us nearly to the place where we need to be on the 1st of July. We've still got 1 week to go and we're running around trying to get everything right, but we are good to go. And there's been enormous amount of hard work and professionalism. And I particularly want to thank the governing body, and you very kindly allowed me to sit in on governing body meetings for the last few months so that I got the hang of what was going on. And that has been extraordinarily helpful. And as you know, I've attended all of them and made furious notes. But today has been a little bit different. I've listened very, very carefully to what each of you have said, and the theme of care for the public and the patients, and the theme of care for the staff has come through very loudly to me. I think that whatever else we do, if we can carry through that passion and that genuine emotion into the ICB, we will not have missed a step. And I just wanted to say a few words to assure you that that is fully my intention. And as we move forward, working more closely with our newly formed boards, which are still, you know, in a very in a state of sort of new beginnings, that I will take that message and many of the other messages that you've made about how integration really works, the importance of process, and the experience of COVID that you lived through, and the learning from that. So I will take all of those. I've made notes. I will take all of those messages forward. And I just wanted this opportunity to assure you of that, and to thank you again for getting us where we need to be for the 1st of July. Thank you, Nicola.
Thanks, Millie. Those words are much appreciated. Thank you very much. Okay, so we've been talking a lot about us and our governing body. Let's find out what we actually achieved though. So Karen and Vasa are going to just give us a little walk through some of the achievements in the CCG. Karen, are you going to start us off?
Thank you, Nicola. While Kate gets the slides up, just to say that I'm obviously doing this on behalf of Sarah, who would have preferred to do this herself, but obviously she's not here today. And when we talked about the meeting today, we wanted to make sure that we took time just to reflect and recognise some of the work that's happened. But because of the time available, it has to be high level, doesn't it? So we're not going to be able to go into huge detail. But hopefully what Vasa and I will do between us is show the breadth of the work that the CCG has been undertaking and the impact that that's made on South West London residents as we've been working. Looking back, we've achieved a huge amount, and that's despite everything that we needed to deal with in the pandemic. So we're going to try and give a flavour of both. I can't see the slides at the moment, so hopefully my machine is just a bit laggy and you can all. But in the 2 years that have passed, it's really been dominated by COVID-19. We've already heard governing body members touch on that. It was the most significant challenge, as we all know, that the NHS has faced in recent years, but also the country. And from a South West London perspective, we saw the NHS, local authority, third sector partners really coming together in such a strong partnership so that the best possible care could be given and provided to South West London people. And we've talked about that, we've noted that throughout the governing body. There was a huge amount of work to keep services running, responding to the pandemic, and also the new challenges that the changing nature of the pandemic brought us. And Vas has already said it probably much more elegantly than I will, but we all saw across the country the incredible commitment from clinical leaders, from NHS staff, the public, and the third sector. Staff from all of our organisations coming together to do what they really needed to around a common goal, which was to make sure that people were supported and protected during the pandemic. Kate, if you wouldn't mind going on a couple of slides, or one more slide, sorry. So what happened in South West London? No, one back, please. What happened in South West London is we led the response to the NHS response to the pandemic. We set up a control room. We ensured the continuation of vital services across the services that we provide, and we also set up clinical networks. So we rapidly adapted services to keep patients safe, and we cared for those whether they had or had not got COVID. We developed new ways to support patients out of hospital. You know, Nicola's already mentioned the fact that we got into the digital age. We also did that with virtual appointments, pulse oximetry. We also drew our community staffing differently and cared for patients in their homes in a way that we needed to do so quite differently during the pandemic. And we focused on those with greatest needs. Vas has already touched on that. We increased virtual access to primary care, outpatients, mental health services. We really used technology to transform our responses in a way that we just had not done before. And also, and we saw in the media, didn't we, the challenge that care homes came under quite quickly. In South West London, we increased our support to our 366 care homes, and we did that through GP leads. We provided pharmacy support, therapy teams, infection prevention support, and also, again, supported them with technology through the rollout of NHS Mail. Would you mind going on one, please, Kate? And then we saw the largest vaccination programme than we have seen in the country, didn't we? From the start of the COVID vaccination programme on the 8th of December to June, we have vaccinated over 3 million. We've administered over 3 million vaccinations through all those different doses. We really listened to what communities were telling us and what the data was telling us. We set up pop-up clinics in mosques, in temples, in churches, in community centres to help us reach into those communities with lower uptakes of vaccinations. It was really important that we were able to answer people's concerns and questions, and a lot of GPs around this table took place in virtual engagement events, reassuring and answering questions for patients and reaching over 8,000 local people face to face on screen. The South West London CCG engagement team worked with clinicians and key community and voluntary sector groups at borough level to help inform people where we really thought the uptake was low, reassure them of the safety of the vaccine and dispel the myths that were circulating, certainly on social media at various points during the vaccination programme. In each borough, we developed borough-based engagement plans with councils and voluntary sector partners to make sure that we really engage with communities and make sure that we did what was right for local areas. We funded the voluntary sector to reach deep into communities to engage with different groups and have conversations and inform people about the vaccine so that they could make informed choices for them. The vaccination programme itself was dependent on a huge, enormous effort from CCG staff, from GPs, from trust colleagues, and very important from COVID matrons, and of course our army of volunteers that joined us when we needed them most. Hundreds of people joined us as marshals and vaccinators, and we're so grateful to all of those people and everyone that had a role in the biggest vaccination programme that we've seen in the NHS. Would you mind moving on one, please, Kate? During the time, though, it was really important that we remained focused on health inequalities. We've heard that through some of the conversations we've already had in the governing body today. It remained a key objective for the CCG. It will remain a key objective for the new integrated care system. And we will build on the work that we've undertaken to date in the CCG and develop population health management in a way that we are already seeing kind of progress in both Sutton and Merton through different approaches to using data to really get to the heart of issues. Would you mind moving on, please, Kate? So we've already talked today, and Agnello said it again very elegantly about the relationships and partnerships that we have across South West London. And this slide brings out some of the examples of the work that we've done with our partners in our communities. So we've commissioned the Ethnicity and Mental Health Investment Project in Wandsworth to help Black people experience of and accessing mental health support and treatment. And Mark is on the call and I know has been instrumental in moving that particular programme forward. We supported vulnerable Sutton residents living in social housing, collaborating with Sutton Housing Partnership to create really accessible health and wellbeing events. In Kingston and Richmond, healthcare and voluntary sector services supported over 140 people who were experiencing homelessness or were refugees or asylum seekers, again supporting their health and wellbeing through days that were designed specifically for them. We're working with people with severe mental illness in Merton to increase participation in the uptake of the annual SMI health checks, and we've talked to Jonathan today through the performance report to see the differences that we're seeing there as a CCG. And we've improved our recruitment and the way we work so that the experiences and the opportunities of our Black, Asian and minority ethnic colleagues within the CCG are improved. Would you mind going on, please, Kate? And we work to continue to transform and join up services throughout the time during COVID and beyond and through COVID. Bringing partners together to deliver a whole range of different things, from virtual wards with teams that care for patients in the comfort of their home across all of our boroughs. The picture is of the peddling paramedic in Merton, who is helping patients receive key primary care services in their own homes and really helping to identify those patients that might need more support sooner. We have seen through the bringing partners together to deliver, we've seen a mental health crisis cafe opening in Sutton for adults. We've seen high blood pressure checks in Wandsworth, putting patients in control of their own health. And in Richmond, we've seen people coming together to support the long COVID issues that we are seeing now. So Hounslow and Richmond Community Healthcare, Richmond Primary Care Networks and Kingston Hospital, bringing teams together from community primary respiratory and Richmond's wellbeing services to help 75 people with long COVID. And that's helping them manage their symptoms, making sure they're getting the right amount of rest, increasing their chance of recovery, but making sure that the team give advice to self-care, sleep, mood, diet, everything that will support people that are going through the challenge of living with long COVID. If we move on one, please, Kate, and there's more. So mental health interventions have been a strong and key part of what the CCG has been involved in. We've worked to improve mental health services for children and young people in Wandsworth, increasing investment there from 3.2 million to 7.5. We've seen increased focus on support for children with autism in Wandsworth and other social and emotional communication needs. We've developed services to include pre-diagnostic support for families, swifter neurodevelopment assessments, early interventions, etc., etc., etc. We've seen increasing success intervening and breaking cycles of crisis through vulnerable children at risk of admission to hospital. So a lot to be celebrating in relation to Wandsworth and its work there. But also we've seen change in Croydon. So Croydon's health and wellbeing space is designed to support the health and wellbeing of the over 18s in Croydon. It's a free service. It looks to connect and gain advice from support workers, psychologists and mental health nurses, again putting care around patients. It's based in Croydon's Whitgift Centre, and it's a partnership of Croydon's BME Forum, Mind in Croydon, the Health and Wellbeing Space, and it aims to provide inclusive and safe space for people. And so far, nearly 100 of people have accessed that support, and there is more planned. And there's even more, isn't there, Vasa? I'm going to hand over to Vasa, and then I'll come back to you again in a little while.
Thank you, Karen. So it must be clear, the last 2 years, yes, the pandemic dominated our life, but what we did, our values and our ethos was not determined or defined by a nasty and a cruel virus. We never forgot in the last 2 years to listen to people, to ask them what was important for them, what they needed from us, and we provided that. And the vaccine project is the testimony for that. We were seen in mosques, in churches, in temples, in community grounds, wherever people asked us to come, whether it was for 4 people or 400 people, we set things up, because even those 4 people we met and vaccinated at a place of their choice was worth that effort. And we continue this commitment. As we go along, we look at what we have done in teledermatology. Next slide, please. There was a request for videos in multiple languages. So clinicians stepped up and spoke a language which they never spoken for many years, but they spoke it for the sake of our patients and recorded videos on how to take photographs to share with the dermatology clinic. Patients with lived experience of kidney disease met and helped us design the service reconfiguration in St. Heliers and St. George's for the renal services. Maternity health is so important for childhood and future education, employment, and health and well-being, and therefore dealing with maternity inequality is an absolutely fundamental thing we need to do, and we did that through health champions and co-connectors. The urology bit, so close to my heart, I'll come to that a little later. During the pandemic, though the virus was trying to determine what we had to do, we didn't forget that there were non-viral diseases we had to look after. We knew that we have to work during the pandemic to reduce the waiting times, and that we did. Next slide, please. The hospitals in Epsom and St. Heliers, if you look at the South West London Elective Orthopaedic Centre, it did more work than it usually did, so that the waiting list for new operations did not increase. At Roehampton, not 1 but 4 operating theatres were set up to deal with non-urgent elective surgery. And in Croydon, and this is very important, despite being so hardly and harshly and badly hit by the virus, both the patients and the staff, despite all that, a hospital was created within the hospital so that there was a safe zone for 300 a week operations to be done, so that when we came out of the pandemic, we found ourselves where we were. The achievement that we have such low numbers of people waiting more than 52 weeks was not accidental. It was not good luck. It was not good fortune. It was the commitment, the leadership, the vision of the leaders to set things up, and the commitment of the staff to step up and deliver those elective surgeries, so that when we came out of the pandemic, be it ear, nose and throat, be it gynecology, be it surgery, be it urology, orthopedics, every single surgical specialty, the waiting list was not as long as it could have been. And it was because of the commitment of the staff. And to that, we have to be grateful for people to make things happen, which just could never have been imagined before. Next slide, please. Now come to urology. This is just an example. We had 15 clinical networks, and every network did its best so that the outpatient waiting list and the elective surgical waiting list was not rising during the pandemic. So when we talk about pathway development as a way of reducing the workload and referral into outpatient clinics, it was not done with the agenda of the hospital or the primary care. We met with patients, we met with women with recurrent UTI, we met with men with low urinary tract symptoms, we met with people who have had long-term indwelling catheters. We met nursing home managers in South West London and asked them, what problems do you have when you look after people with catheters? Based on that insight, the mandate, and the request of those people, we develop pathways to look after patients with low urinary tract symptoms. Hospital clinicians, primary care clinicians, community clinicians, doctors, nurses, pharmacists, physician associates, many others were involved in decision making And this pathway, which is now common across Northwest London, helps us manage patients early. That's what the women said. Frequent UTI, they wanted early investigations. The men with lower urinary tract symptoms said that they want early intervention. They prefer the GP to prescribe the medication rather than wait months to see a consultant to get the same medication. And this is what we have done across all specialities. We went to Pollard's Hill, deprived part of East Merton, where we not once, but not twice, but thrice, we had urology clinical network presence at events, at churches, at community fairs to ask, talk, explain. Next slide, please. Primary care. Primary care in 2020, at the beginning of 2020, and in March, April 2020, you couldn't ever imagine how much it changed, and it changed within a day or two. Next slide, please. We changed to meet the demand. We suddenly discovered that we could manage respiratory pathways. So we suddenly decided we could understand pulse oximetry and deal with pulse oximetry. We prioritized our patients, the people with learning disability, people with mental illness, people with poorly controlled blood pressure, people with poorly controlled diabetes. We knew who needed to be seen despite and during the pandemic. We supported care homes like we had never done before. And we reached out to care homes and we helped them during the hour of need. GP capacity increased at times during bank holidays. We working with the federations, the provider alliance, we increased the number of consultations we did during bank holidays. We recruited new staff during the pandemic. New roles were created. Clinical physician associates, clinical pharmacists, paramedics, physiotherapists, and mental health workers. We have expanded the workforce in primary care during the pandemic to support patients and to bring specialism down into primary care so that people can have mental health support and physiotherapy in primary care. Next slide, please. Prevention never went away even during the pandemic. Next slide, please. Now, there are projects all over South West London. In Kingston and Richmond, this example here where we provided anticipatory care, where more than 1,000 conversations have taken place regarding older vulnerable people, identified by the computer using risk assessment software, identified by clinical judgment of the clinicians, and also identified by feedback. At times, the best person who can point me towards somebody developing early dementia is my receptionist, who tells me, Mrs. Robinson is not looking like he normally looks. She always comes to see you Sunday best, hair combed, but now the hair is not combed and certainly not Sunday best. And that is the beginning of dementia, pointed to me, highlighted to me by my receptionist. And this is the type of soft intelligence we use in primary care to identify people, and then we refer these people to the multidisciplinary team, where we work with the voluntary sector, work with the community nursing, care homes, everybody and anybody who can help that person. Social services to deal with social isolation and their medical problems, so that people, as quoted here, feel that they are safe, they are more independent, and they can be happier, safer, and feel comfortable and not frightened, isolated, and lonely in their homes. Next slide, please. Back to you, Karen.
Thank you, Vasa. So as we move into the new system, as well as hearing obviously the reflections from everybody around this table, virtual table, and all of the work that we've put together to produce this presentation, we've also been asking our staff, would you mind just going on, Kate? And what we're doing is we've asked them, we've got a one thing I'm proud of campaign. We asked them one thing that they're proud of, but also one of the things they're excited about in terms of the new system. And we're going to be taking those with us. But just to let you know that we're also reflecting our staff's nuggets as well as we move forward. Would you mind going on to the final slide then, please, Kate? So I suppose the final thing to say is to thank everybody. We've done quite a lot of that individually and collectively already today. But on behalf of Sarah, thank you all. Thank you to the people of South West London, the staff, our clinicians and partners who have really supported the CCG on its journey to the end of June. And Nicola, I suppose you thanked everybody earlier, didn't you? We want to make sure that we thank you too. I suppose not only for stepping into the chairman role when we needed you to do it, but also because you've been such a steadfast voice and person of reason certainly through all the time I've known you. So the voice of primary care, the leader of primary care transformation. You are known for your outstanding commitment and for your energy. I don't quite know how you do all the things that you do, but we benefit from that. You've been the voice of Wandsworth through the clinical chair role. You've led South West London programmes and improvements in CVD, hypertension, etc. You have care through your core, and you have also at your heart making things better for patients and people in South West London. So we thank you for all you have done and all you will continue to do in the ICB as we move forward. I suppose some other words for everybody around the table really, and Millie touched on this earlier, and everybody has in some of the ways in which they've talked today, but the work of the CCG has provided a really, really strong foundation from which the integrated care system can move forward. Because of the work of the CCG, Agnella already mentioned this, so did Pippa, strong relationships exist throughout, across and throughout organisations and professions, and they are all focused on the best care for patients. We have strong relationships with local authorities, the NHS, voluntary organisation, community groups. That all happens in boroughs that invest time and effort in those relationships and really coming together on the things that matter for local people. Because of the work of the CCG, the ICS is in a really, really strong place in which to grow, and that is down to the work of every member of the CCG over its lifetime, but it's also down to the guidance, the support, and the well-led governing body that we've seen over our time too. So I just want to give Sarah's thanks for everyone around the table for the support that they've given her, for the changes that we've collectively made, and for the strong legacy that the CCG leaves because of that. Finally, I think I just wanted to say that I hope you stay connected and involved in the ICS as we move forward. And all the work that we still need to do. As Jonathan mentioned in the performance report, we do things well, but there is so much more that we need to do to improve care and services for patients. And we hope that you'll continue to be with us on the virtual journey if you're not with us in person. But thank you very much for everything that you've done.
Oh, thank you, Karen, and thank you for your kind words, and thanks to you and Vasa for that presentation, just showcasing you know, some of the things that we've done. Really, really nice to remind us of what's been achieved by you know, the people in our system. Really great to see that. So we have just, if no notification of any questions from any members of the public. If there is anybody who wants to ask a question now, then now is the time. Just to check if anybody wants to. No. Thank you. Then in that case, we've not been notified of any other business. So just a closing remark from me, really. Just that we've heard an overview of some of the work of the CCG, and we've heard thoughts from our departing governing body members, and I think that's a great illustration of the knowledge and expertise we've had in this virtual room, and we've really built a strong foundation. And our departing colleagues have advised us to be compassionate and caring, to build relationships, to be agile in change and to innovate, to look after our staff, to listen and involve the people that we serve. That how we do things is as important as what we do, and we're going to ensure that we value the involvement of clinicians supported by our management expertise and using the insights and understanding of our patients and communities. I hope I kind of captured those nuggets into one great big golden one. I hope we can make a difference and be ambitious about what we can achieve for and with our populations as we become an ICS. So to those of you who won't be coming on the next part of the journey, we wish you farewell and all the best in whatever you do beyond this, and I do hope that you'll keep in touch. But for now, it's time to close this chapter. So my thanks to everybody who attended today. Thank you.